AHPs form the third largest workforce in the NHS, and at UCLH we have a very wide range of AHPs contributing to patient care throughout their journey through the hospital and also when they go home. Many people are aware of the more well-known AHPs. We have physiotherapists and occupational therapists. We have speech and language therapy, nutrition and dietetics, radiography. But there are some lesser well-known roles such as prosthetists, osteopaths and ODPs. We provide a variety of care into specialist and complex pathways such as neuro-rehab and many types of cancers, as well as supporting our local population in urgent and emergency care and frailty.
My name is Kashanda, I'm 11, so I'm from the British Virgin Islands. I have osteosarcoma, which is a rare bone cancer, and I had to get my right leg amputated and I had to come to London for a treatment. It was quite a shock to know that I have to have chemo and I didn't know what it was. But it was quite a good experience for me because I got to meet a lot of new people and I could finally know that the cancer was gone and no more of it was ever left to be in my body.
And you want to keep your leg up. Good.
A physiotherapist is someone who helps you build back your strength and they help you to build your self-confidence.
I'm shaking.
We practice getting on and off the escalators, getting on and off the tubes. On a bad day, they'll just say, can we do it a different date? And they'll understand. But I find that if they come in with a smile sometimes, it might brighten up my day and say, okay, well, I'll just do some physio. Each of them have their own different personality. Abu, he's calm, he's cool. He makes sure that you know what you have to do and he wants you to do it as best as you can. When I get my new leg, I would like to get back to dancing, cooking, singing. I would love to be a teacher. I would love to teach kids that you can be strong even though you go through tough things. And I find that very encouraging. To know that I can be brave and be strong, that's quite good for me.
I'm Andrew Gaylor. I had a tumour in my parotid gland of my neck which spread to my facial nerve. So gradually the left-hand side of my face got paralysed. I had 10-hour surgery with 4 surgeons and then a radiotherapy. It's incredibly dehumanising and isolating. The complications are horrendous, so it's just affected everything: eating, swallowing, saliva, taste. So speech and language and the dietitians together worked very closely with me right from before my treatment started. They were a bit of a lifeline through the really traumatic bit. It just felt a very safe environment where I could talk and have a cry and talk about my worries, and they were just very supportive. On whatever stage I was at, they would do everything they could to adapt their suggestions to help me at that particular stage. The dietitians produced recipe booklets to give patients ideas on how to fortify what they can drink and so on to get the calories, because calories is a big problem. The radiographers during my treatment were really kind and patient, because I gradually deteriorated to the extent that sort of in the last couple of weeks I wasn't even able to walk down the corridor myself. I had to be pushed down in a wheelchair. And I think what struck me with them was how incredibly careful they were being to minimise the sort of collateral damage. One of the things that I was really struck with was how well joined up everything was, that I didn't have to fight to get to see somebody. They just seemed to come to me and support me. I honestly think that they've helped get me back onto my feet and sort of feel part of the human race again.
As most people who've survived a stroke will tell you, 1 minute you're living your life normally, the next minute it's taken from underneath your feet. And I was taken to the hyperacute stroke unit and stayed in hospital for 7 weeks. I had amazing clinical care, but the thing that made The biggest impression on me was the help that I got from allied health professionals, in particular the occupational therapists, who certainly for me, gave me my life back. I was seen by the vocational rehabilitation service. They help people with neurological disorders get to work, stay in work and reclaim their lives. And they are experts. They knew all the latest papers on different aspects of trying to live well. You always look forward to seeing someone who was, fighting for you. I've just been discharged, so I'm back at work now. I wouldn't be here, really, if it wasn't for them.
2016, my knee started to hurt. My GP said that it was just like a tendon or something. But then one day my knee really, really hurt. They wanted to do a biopsy on my leg. They got the results back on the 9th of March and they said that it was a tumour. And the first lot of chemo made me feel really bad. Then for my methotrexate, which was my second chemo, I reacted really badly to it. So I basically stayed in bed for a month, basically, 4.5 weeks. And then somehow Alice and Becca persuaded me to get out of bed. It wasn't, if you don't do this, you'll never walk again. It was just like, you can decide what we do and how much we do. Alice decided to get me a notebook, and every day that I did something, she would write it in as an achievement and then a goal for the next day. Then I decided to just try and walk to the height chart and back, and it was because of their encouragement that I decided to do that. Anything that I did, she said that it was good. They kind of just made it sound fun and just let you be you, basically. Like, I love photography and I couldn't stand up long enough to do that, but I think May, I went outside and stood in our driveway, took some photos of the moon, and it's all because of them.
My baby was born 3 weeks premature. I tried breastfeeding right from the start. He was latching on wrongly and the pain was unbearable, so I started expressing the milk and giving Isaac the bottle. One day, I looked down on him and he's grey. I look at my sister and I say, "Do you think he stopped breathing?" And she said, "Yes, you've got to run to A&E. I think the baby had an apnea." They put him on a monitor straight away. They feed him and he has an apnea again. So they give him heart scan, brain scan, 2 x-rays. It was a scary time until I saw a speech and language therapist. She looks at us and she realized that he was having problems coordinating his breathing and his swallowing. She thinks, why don't we change the teeth? And she said, why don't you try a premature teeth, so very, very, very slow, designed for babies who can hardly suck. The change gave him the chance of coordinating the two and thinking, okay, now it's breathing, now it's swallowing, it's breathing, swallowing, breathing and swallowing. And I realized she cracked it. I was very surprised to see that a speech and language therapist was involved so early. Speech and language is about the mouth, how it's made and how it works, and the tongue and the palate, and so obviously they can help right from the beginning because sucking is essential for the baby to keep alive. It was the passion that I saw from this person. She took on board our relationship as well and how to help us live our lives together outside the hospital.
We have some very specialist AHPs who don't only assess, but they can also diagnose and treat complex problems.
I'd never heard of my condition, my GP hadn't heard of it. I was told that there was no medication that would really help me and that I needed to see a specialist dietitian.
I'm a gastroenterology and neurogastroenterology dietitian, so that involves me seeing patients who have more complex gastrointestinal disorders. We work with what we call like a biopsychosocial model. So we integrate psychology, dietary advice, medication advice, lifestyle interventions to improve their gastrointestinal symptoms.
Lee explained to me that gastroparesis is actually paralysis of the stomach, which means that I do not digest food in the normal way. He placed me on a low FODMAP diet. Everything's been done on a very gradual and careful basis, but I now feel that I've got the confidence to actually manage my condition.
As an HP, it's a great feeling to know that all the care you provide patients continues to make a difference to people's lives, in hospital and at home. I'm proud of the HPs working here. They're a dedicated workforce providing the best care that they can, and it's rewarding to hear our patients feel the same way.